Florence Nightingale was an English social reformer, statistician and the founder of modern nursing. Nightingale came to prominence while serving as a manager and trainer of nurses during the Crimean War, in which she organized care for wounded soldiers at Constantinople. She gave nursing a favorable reputation and became an icon of Victorian culture, especially in the persona of the lady with the lamp, making rounds of wounded soldiers at night. Recent commentators have asserted that Nightingale's Crimean War achievements were exaggerated by the media at the time, but critics agree on the importance of her later work in professionalizing nursing roles for women. In 1860, she laid the foundation of professional nursing with the establishment of her nursing school at St. Thomas' Hospital in London. It was the first secular nursing school in the world, and is now part of King's College London. In recognition of her pioneering work in nursing, the Nightingale Pledge taken by new nurses, and the Florence Nightingale Medal, the highest international distinction a nurse can achieve, were named in her honor, and the annual International Nurses' Day is celebrated on her birthday. Her social reforms included improving healthcare for all sections of British society, advocating better hunger relief in India, helping to abolish prostitution laws that were harsh for women, and expanding the acceptable forms of female participation in the workforce. Nightingale was a pioneer in statistics. She represented her analysis in graphical forms to ease drawing conclusions and actionables from data. She is famous for usage of the polar area diagram, also called the Nightingale rose diagram, equivalent to a modern circular histogram. This diagram is still regularly used in data visualization. Nightingale was a prodigious and versatile writer. In her lifetime, much of her published work was concerned with spreading medical knowledge. Some of her tracts were written in simple English so that they could easily be understood by those with poor literary skills. She was also a pioneer in data visualization with the use of infographics, using graphical presentations of statistical data in an effective way. Much of her writing, including her extensive work on religion and mysticism, has only been published posthumously. Florence Nightingale's most famous contribution came during the Crimean War, which became her central focus when reports got back to Britain about the horrific conditions for the wounded at the military hospital on the Asiatic side of the Bosporus, opposite Constantinople, at Scutari, a modern-day Üsküdar in Istanbul. Britain and France entered the war against Russia on the side of the Ottoman Empire. On the 21st of October 1854, she and the staff of 38 women volunteer nurses, including her head nurse Eliza Roberts and her Aunt Mai Smith, and 15 Catholic nuns, mobilized by Henry Edward Manning, were sent, under the authorization of Sidney Herbert, to the Ottoman Empire. On the way, Nightingale was assisted in Paris by her friend Mary Clark. The volunteer nurses worked about 295 nautical miles, 546 kilometers, 339 miles, away from the main British camp across the Black Sea at Balaclava, in the Crimea. Nightingale arrived at Selimay Barracks in Scutari early in November 1854. Her team found that poor care for wounded soldiers was being delivered by overworked medical staff in the face of official indifference. Medicines were in short supply, hygiene was being neglected, and mass infections were common, many of them fatal. There was no equipment to process food for the patients. After Nightingale sent a plea to the Times for a government solution to the poor condition of the facilities, the British government commissioned Isambard Kingdom Brunel to design a prefabricated hospital that could be built in England and shipped to the Dardanelles. The result was Renkioi Hospital, a civilian facility that, under the management of Edmund Alexander Parkes, had a death rate less than 1/10 of that of Scutari. Stephen Paget in the Dictionary of National Biography asserted that Nightingale reduced the death rate from 42% to 2%, either by making improvements in hygiene herself, or by calling for the Sanitary Commission. For example, Nightingale implemented hand washing and other hygiene practices in the war hospital in which she worked. During her first winter at Scutari, 4,077 soldiers died there. 10 times more soldiers died from illnesses such as typhus, typhoid, cholera, and dysentery than from battle wounds. With overcrowding, defective sewers and lack of ventilation, the Sanitary Commission had to be sent out by the British government to Scutari in March 1855, almost 6 months after Nightingale had arrived. The commission flushed out the sewers and improved ventilation. Death rates were sharply reduced, but she never claimed credit for helping to reduce the death rate. Head nurse Eliza Roberts nursed Nightingale through her critical illness of May 1855. Later career. In the Crimea on 29 November 1855, the Nightingale Fund was established for the training of nurses during a public meeting to recognise Nightingale for her work in the war. There was an outpouring of generous donations. Sidney Herbert served as honorary secretary of the fund and the Duke of Cambridge was chairman. Nightingale was considered a pioneer in the concept of medical tourism as well, based on her 1856 letters describing spas in the Ottoman Empire. She detailed the health conditions, physical descriptions, dietary information, and other vital details of patients whom she directed there. The treatment there was significantly less expensive than in Switzerland. Nightingale had £45,000 at her disposal from the Nightingale Fund to set up the Nightingale Training School at St Thomas Hospital on 9 July 1860. The first trained Nightingale nurses began work on 16 May 1865 at the Liverpool Workhouse Infirmary. Now called the Florence Nightingale School of Nursing and Midwifery, the school is part of King's College London. In 1866 she said the Royal Buckinghamshire Hospital in Aylesbury near her sister's home Claydon House would be the most beautiful hospital in England, and in 1868 called it an excellent model to follow. In the 1870s, Nightingale mentored Linda Richards, America's first trained nurse, and enabled her to return to the United States with adequate training and knowledge to establish high-quality nursing schools. Richards went on to become a nursing pioneer in the US and Japan. By 1882, several Nightingale nurses had become matrons at several leading hospitals, including, in London, St Mary's Hospital, Westminster Hospital, St Marylebone Workhouse Infirmary, and the Hospital for Incurables at Putney. And throughout Britain, Royal Victoria Hospital, Netley, Edinburgh Royal Infirmary, Cumberland Infirmary and Liverpool Royal Infirmary, as well as at Sydney Hospital in New South Wales, Australia. In 1883, Nightingale became the first recipient of the Royal Red Cross. In 1904, she was appointed a Lady of Grace of the Order of St. John, LGSTJ. In 1907, she became the first woman to be awarded the Order of Merit. In the following year she was given the Honorary Freedom of the City of London. Her birthday is now celebrated as International CFS Awareness Day. From 1857 onwards, Nightingale was intermittently bedridden and suffered from depression. A recent biography cites brucellosis and associated spondylitis as the cause. Most authorities today accept that Nightingale suffered from a particularly extreme form of brucellosis, the effects of which only began to lift in the early 1880s. Despite her symptoms, she remained phenomenally productive in social reform. During her bedridden years, she also did pioneering work in the field of hospital planning, and her work propagated quickly across Britain and the world. Nightingale's output slowed down considerably in her last decade. She wrote very little during that period due to blindness and declining mental abilities, though she still retained an interest in current affairs. Death. The grave of Florence Nightingale in the churchyard of St Margaret's Church, East Wellow, Hampshire. Florence Nightingale died peacefully in her sleep in her room at 10 South Street, Mayfair, London, on 13 August 1910, at the age of 90. The offer of burial in Westminster Abbey was declined by her relatives, and she is buried in the churchyard of St Margaret's Church in East Wellow, Hampshire, near Embler Park, with a memorial with just her initials and dates of birth and death. She left a large body of work, including several hundred notes that were previously unpublished. A memorial monument to Nightingale was created in Carrara marble by Francis William Sargent in 1913, and placed in the cloister of the Basilica of Santa Croce in Florence, Italy. Nightingale's lasting contribution has been her role in founding the modern nursing profession. She set an example of compassion, commitment to patient care, and diligent and thoughtful hospital administration. The first official nurses training program, her Nightingale School for Nurses, opened in 1860, and is now called the Florence Nightingale Faculty of Nursing and Midwifery at King's College London. In 1912, the International Committee of the Red Cross instituted the Florence Nightingale Medal, which is awarded every 2 years to nurses or nursing aides for outstanding service. It is the highest international distinction a nurse can achieve, and is awarded to nurses or nursing aides for exceptional courage and devotion to the wounded, sick or disabled, or to civilian victims of a conflict or disaster, or exemplary services, or a creative and pioneering spirit in the areas of public health or nursing education. Since 1965, International Nurses' Day has been celebrated on her birthday, the 12th of May, each year. The President of India honours nursing professionals with the National Florence Nightingale Award every year on International Nurses' Day. The award, established in 1973, is given in recognition of meritorious services of nursing professionals characterized by devotion, sincerity, dedication, and compassion. The Florence Nightingale Declaration campaign, established by nursing leaders throughout the world through the Nightingale Initiative for Global Health, aims to build a global grassroots movement to achieve 2 United Nations resolutions for adoption by the UN General Assembly of 200. They will declare the International Year of the Nurse 2010, the centenary of Nightingale's death, the UN Decade for a Healthy World 2011 to 2020, the bicentenary of Nightingale's birth. Nightingale Initiative for Global Health also works to rekindle awareness about the important issues highlighted by Florence Nightingale, such as preventive medicine and holistic health. As of 2016, the Florence Nightingale Declaration has been signed by over 25,000 signatories from 106 countries. During the Vietnam War, Nightingale inspired many U.S. Army nurses, sparking a renewal of interest in her life and work. Her admirers include Country Joe of Country Joe and the Fish, who has assembled an extensive website in her honor. The Agostino Gemelli Medical School in Rome, the first university-based hospital in Italy and one of its most respected medical centers, honored Nightingale's contribution to the nursing profession by giving the name Bedside Florence to a wireless computer system it developed to assist nursing. Thanks for watching HerStory channel. Don't forget to like the video and subscribe our channel.